my name is Vanessa.
And we're going to be doing a skin assessment.
So today we'll be assessing the ABCDs of the skin.
And we'll also be testing for edema and just going through like a skin assessment that you would go through in the hospital. Okay, so when you enter a patient's room, you're going to disinfect your hands, greet yourself, and you're going to make sure the patient is able to identify themselves and that the name and the date of birth obviously is correct to the patient that you're assessing. Before you start any palpations, you would start to inspect the skin. On a regular patient, they would wear a gown, but because we are at school property, she's obviously wearing something that will cover, so I'm mostly going to be assessing her arms. So when you're assessing, you're going to start by looking at, you know, the color on the skin, the hair distribution, any kind of scars or abnormal lumps or anything that you see on the skin. We're actually going to be looking into the moles, which Vanessa is actually going to take part, and she's going to go into deeper depth. And then we would also assess for edema, which Ricarldine is going to be going in. I'm going to be looking at temperature, I'm going to be looking at the color, I'm going to be looking at distribution, any abnormal lesions or scars that stand out. I'm also going to be looking at is the color, you know, evenly distributed throughout the body. So for palpation, you're going to use the back of your hand. And you're just going to be patting down and making sure that it's equal bilateral on both sides, it's warm. Also on a patient in the hospital, one of the biggest concerns is our patients having pressure ulcers. So you would want to check those pressure points on the skin that can possibly have any redness or signs of ulcerations that are coming through. So the way you would assess turgor is usually using the skin by the clavicle, but because she obviously has a sweater on, I'm going to just attest it with the skin here. Her skin turgor should be elastic. It should recoil quickly. It shouldn't be slow. If it is slow to recoil, it can be a sign of edema or dehydration.
Hi, my name is Ricarldine, and I'll be checking the skin for edema. So basically, edema is when there's excess fluid trapped under your skin tissue. And the way you assess edema is when you press firmly into the skin. And if it doesn't have any pitting mark, it means there's no edema present.
Okay, so now I'm gonna have Vanessa come in and speak to you guys about the ABCDEs of the moles.
So if you come over, our patient has a mole on the left arm that is symmetric, and we also have an abnormality of a mole that is non-symmetric. If we go to B, B stands for border. This border is non-irregular and it's circular, but if you look at the abnormality of the mole, it is irregular. It has an irregular border. So C stands for color. Color is same all throughout the skin and all throughout the rest of the portions of the body. As we can see for the abnormality, the skin is unproportioned and discolorated throughout the body. So D stands for diameter, and this symmetric mole is within the 6 centimeters, which is considered a normal finding of a mole. As we look at the abnormality, which is more than 6 centimeters of the irregular border of the mole. And for E, standing for evolving for the symmetric mole, has it changed over time?
No, it has not.
Okay. And we're gonna ask for the abnormality of this mole. Has this mole changed over time?
Actually, yes, all the time.
In conclusion of my findings, the patient's mole, which is abnormal, has now been concluded that it may potentially be a cancerous mole due to it being non-symmetric, due to the borders being irregular, due to the color not being the same throughout the skin, as well as the diameter being more than 6 centimeters, and as well as it changing over time.
So do you have any questions for me today?
Yeah, I actually do. How would I be able to assess my skin at home and just look for any abnormalities throughout any other moles?
Okay, so in conclusion of the assessment, you would obviously look at your skin's color, you know, if there's any changes, you know, that are abnormal, as far as like, let's say that you have a really big bruise here and it's not healing, or you know, the skin on this arm is a lot more paler than it is on this arm. That's an abnormal sign. You would also look for your hair distribution. I mean, is it growing evenly throughout? Is there patches on your skin? And then for obviously your moles here, you can look at any different moles and compare them to any abnormal moles such as this one here. So you can go at home, you know, do the ABCDEs, which Nurse Vanessa went over, and those are kind of things that you can do at home to self-assess your skin.
Thank you so much.